Hello, everyone. My name is Sejan Stephen Park with LA County Library, and I welcome you to our Life Skills for Emerging Adults presentation, focusing today on substance use and awareness. This series is supported in part by the U.S. Institute of Museum and Library Services, administered in California by the State Librarian under the provisions of the Library Services and Technology Act. This is our fourth virtual program in this series for LA County, focusing on helpful life skill topics for emerging adults ages 18 to 25. Along with a series of virtual programs, we're also offering in-person events on these topics at library branches in Lancaster, San Fernando, Compton, South Whittier, and East LA. You can register and find more information on our website at visit.lacountylibrary.org. Now, it's my pleasure to introduce our guest speaker from the Los Angeles Department of Public Health, Mr. Luis Renteria. Hi, Luis.
Hi, everybody. How's it going? So my name is Luis Renteria. I work for Los Angeles County Department of Public Health. Nice to meet you all.
Thank you. Mr. Luis is an experienced substance use counselor and has provided counseling, outreach, and support for Special Planning Area 6 and beyond in South Los Angeles and throughout LA County. And we're very grateful to have him here today to share his expertise and guidance on one of the most significant challenges to emerging adults in LA County today. Thank you, Luis. The stage is yours.
All right, thank you. All right, so, all right, excellent. All right, so everybody, as mentioned, my name is Luis Renteria. I'm from the Los Angeles County Department of Public Health. I work out of the MLK Core Center, which is located in the city of South Los Angeles. I will be turning my camera off so we could focus on the actual slide. Today's topic, as you can see, is recognizing and responding to an overdose with naloxone for young youth and adolescents. As you know, fentanyl is a big thing that's been going on in Los Angeles County, and not just in the county, but throughout the nation. So we're going to go ahead and discuss that. All right, so here we go. Before we begin, I also like to start off with, a disclaimer. Obviously, welcome everybody. So the guidelines for today is please be respectful of each other. All personal stories and questions stay in this room. Do not bring up names or specific people or organizations. We want to make sure we respect the organizations or persons' anonymity to make sure that they're not brought up to light. We're here if you have if you need to talk about anything or have questions after. This can be a difficult topic. You can step away at any moment during our presentation and come back if need be, okay? Because it is a sensitive topic. All right, so once again, welcome. I do have the presentation as an interactive presentation. I like to, to have people kind of interact and see what they're thinking. So today's question, I have two questions for you to pose. The first one is, what brings you here today? And the second is, what do you hope to get out of our time together? And then again, if somebody can help me with the chats or any then anything that somebody would like to share about those two questions specifically. And they can be anybody, doesn't matter.
Yeah, participants, please feel free to reply or type your responses in the chat that you see. For me, Luis, I'm really curious to how LA County is responding to something that's we see on the news all the time, and
Right.
We feel like in LA all of the problems that we see are sort of magnified and focused here because we're such a center for just people and culture.
Right. Right, absolutely. Anybody else would like to share or have questions about anything before we proceed?
I have a comment
Okay.
from President. They are interested in the topic and they want to learn something helpful.
Okay, perfect.
Yeah.
All right, awesome. All right, if there's any more, I'm going to go ahead and move forward with the presentation. Any more comments or questions? All right, so next, hopefully, by the end of the presentation, you will take away certain objectives. The first one is hopefully discuss 2 risk factors that may increase risk of overdose and ways to reduce the risk. Number 2, develop 3 skills to recognize and respond to an overdose with opioid substances. And lastly, identify 3 steps to safely respond to an opioid overdose with naloxone. So here's a poll question. You don't have to answer it. I'm just going to throw that out here. Which of the following are considered an opioid? So here you have Norco, heroin, Oxycontin, fentanyl, and Percocet. And the answer is all of them. Okay, so all of them are considered opioids. So the question is, what are opioids? Before I go to the next slide, though, there is a disclaimer. For those of you who may be struggling with recovery or may have a problem with seeing certain substances, now's a time to, if you feel like walking away, you can, and then come back. There are some pictures that may be graphic, so just a disclaimer. And I'm not going to spend too much time, but I do want to be considerate of those who, are in recovery or going through a struggle. So here we go. What are opioids? So here we have, we're going to focus on 3 today. So heroin, as you can see, it can come in a powdered form, sometimes in a tar-like substance, and they range anywhere from dark brown to even white sometimes. It's made obviously from opium poppy plants, and again, the color white or brown powder depending on where it comes from. We also have prescription opioid, which is medicine prescribed by doctors for pain. For example, if you get in a car accident, or things of that nature, any type of pain. Now, there is such a thing as legal fentanyl and illegal fentanyl, which we're going to talk about here in a second. But you do have other examples given, like Oxycontin, Percocet, and Vicodin. Now, I will say, before I go on to fentanyl, is that one of the biggest misconceptions that individuals have about fentanyl is that individuals are actually seeking fentanyl, and that's not the case when it comes to a lot of these cases. What's happening is they're seeking other types of drugs like Percocet, even marijuana, vape pens, any type of drug that happens to be laced with fentanyl. So this misconception of, I know sometimes I hear loved ones are, oh, well, my kid doesn't use fentanyl, or I don't use fentanyl. That's great, but a lot of times, things that regular adolescents or teenagers use happen to be laced with fentanyl, and that's the issue that we're facing. So for fentanyl here, we see a white powder, sometimes bluish color, again, depending on who makes it, who manufactures it. I will say that I have seen fentanyl in different types of colors, like rainbow, obviously to attract young adolescent individuals. But sometimes this is mainly what you look at, blue, white, maybe off-colored blue or off-white. But this is basically how it looks like. So what is fentanyl? Okay. So it's a very, very powerful pain medication. Now, fentanyl is about 50 to 100 times more potent to morphine. Okay. So it's very, very powerful. If you can see here, it can be mixed into other drugs like heroin, cocaine, methamphetamine, and that's one of the problems that we encounter. Again, they lace it with other types of substances and drugs, and I've even heard of even in drinks at times, which is very, very dangerous. And again, it can cause overdose and death. And then here you see the potency with the 2 vials. There's fentanyl and heroin. Just how much little fentanyl compared to heroin. That's how potent the fentanyl is. And again, we do have prescribed fentanyl, which you get at the hospital, and again, that's prescribed by a doctor in severe cases of pain. Like, let's say you got into a real bad accident and they had to amputate a limb or something of that sort, where you're in extreme pain. A doctor would make that decision if the other opiates, prescribed medication is not working. But what we're talking about now specifically is street fentanyl, which is very, very deadly. Now, I often get the question, well, what do I look for when somebody's overdosing versus somebody who's impaired or under the influence. So here we see differences. We'll go ahead and start with somebody who's impaired. A lot of times somebody who's under the influence or quote, high, unquote, so to speak, they may seem relaxed. They can still talk and have conversations, but it might be slow or slurred. Sometimes they may be sleepy. They will nod, but they do respond to stimuli. For example, if you yell at them, if you call them, if you talk to them, they're still coherent, okay? So that's one of the important things to know. They still respond to stimuli, to if you scream, if you yell, or to get their attention, they'll notice it. Obviously, slower heartbeat. Now, when it comes to an overdose, it's very different, okay? They can have pale, clammy skin. Perhaps their lips or fingernails, the tips of their fingernails are blue, and that's because of the lack of oxygen. Very infrequent or not breathing at all. Deep snoring, possibly shallow or slow gurgling sound coming out of their breath. Heavy nods, not responding at all to stimulation. You yell at them, you don't shake them to the point where you're going to hold them, but enough to get their attention. And if they're not responding, then there's a problem. And then obviously, no heart rate or no pulse whatsoever. So those are the two differences. Now, sometimes I've been asked, what if somebody's impaired and they look like they're overdose? Should I give them Narcan or Naloxone? My theory is, when in doubt, take it out, okay? Because you don't know, especially if they're not responding. You want to make sure that the person's okay, and again, you want to make sure that the environment is safe for you as well, because if the environment is not safe, you might want to get first responders to go there and assess the situation if you're not sure, and we'll talk about that here in a second as well. Any questions on this screen in terms of impairment versus overdose? Any questions? And again, feel free at any point of the presentation, whether I'm speaking or not, feel free to put something in the chat, and I'll be more than willing to provide an answer for you all. Okay, so the next question, another poll question: how many youth and young adults ages 15 to 24 in California have died from an opioid overdose in 2020? So the answer is E. 853 youth and young adults ages 15 to 24 have died in the state of California from opiate overdose, which is very, very unfortunate. And again, way too young for this to happen. A very tragic situation. So here nationally, meaning within the United States, 1 in 7 high school students reported, abusing prescription opioid substances at least once in their lifetime. 4,063 youth have had opiate overdose deaths were recorded in 2019 nationally. And again, this is throughout the United States. In LA County, there's been a 200% increase in youth with drug accidental overdose compared to 2019. So it is on the rise, and unfortunately, the demographics are adolescents and young adults. So the good thing about this workshop is that we're going to talk about how to be drug-free, how to stay away from substances like these, and what you can do to help an individual that may be suffering from an overdose. So here I have a short film, and then we're going to go ahead and proceed. And let me know again if you can't hear it or if there's a problem with it.
Naloxone saves lives. No time to sit idly by. More and more people are dying of overdose from the likes of heroin, fentanyl, and prescription pain medications like oxycodone and hydrocodone. These are all examples of opioids. Opioids are drugs derived from the opium poppy plant or made in the lab. They can treat pain, cough, and diarrhea. But opioids can also be addictive and even deadly. The number of opioid overdose deaths has escalated more than 400% since the turn of the century, with tens of thousands of lives now being lost every year. But many deaths can be prevented with a life-saving treatment, naloxone. When given right away, naloxone can work in minutes to reverse an overdose. Naloxone is safe, has few side effects, and some forms can be administered by friends and family. When is naloxone?
Okay, there it goes. All right, so risk factors for overdose. Do we have something in the chat? I think I don't know if I saw something.
There's replying that they can hear. We did have a question come up.
Okay.
I've heard that you can be affected by fentanyl by just touching it. Is that true?
Correct. So depending on the potency of fentanyl, you can if it's in the, like, let's say for instance, I don't know if you've seen the YouTube video of the sheriff that actually opens a trunk and they get a whiff of the fentanyl, and actually the partner has to come in and administer naloxone. That's how potent fentanyl is.
Oh, wow.
Yeah, so we have to be mindful as well. And again, it depends on where it comes from, if it's been cut many times, or if it's pure. So all those factors determine the potency of it as well. But yeah, that's a great question. Excellent question. Any other questions?
Not at this time.
Okay. All right, so risk factors for overdose. Okay, so here we see a couple, obviously injecting opioids mixed with cocaine. Again, injection, snorting other drugs, mixing it with other drugs, and combining it with opioids and tranquilizers. Tranquilizers, for example, being like Klonopin, Xanax, Ativan, things of that nature. Now, again, the next slide coming up also, it does have some graphic content. For some, it may not be a big deal, but I always like to have a disclaimer just in case. So other risk factors, reduced tolerance to a type of opioid. So tolerance is basically how much your body can tolerate of the substance. So if your body's not used to, that drug, and your tolerance level is not as great, then obviously you're going to have an issue. A lot of times when it comes to overdose as well, there's individuals that have used a type of substance and they're sober for an X amount of years, and then they come back thinking they can use the same amount. Well, guess what? Their tolerance level actually has gone down. So what happens is when they go back to use the same amount, their body can't handle it. And that's where a lot of the overdoses happen as well. Not just with fentanyl, it can happen with other things as well. So not just with fentanyl. Again, buying from an unfamiliar place, supply changes. Sometimes I'll have young adolescents tell me that they bought stuff online, not knowing that it's been laced with certain things, including fentanyl, or having somebody else inject you that you don't know who they are, and using alone. Okay. That's a big thing. Obviously, if you use alone, there's nobody going to be there to help you. Now, one of the things that the county, does not advocate is obviously using substances. The county advocates for you to, to be sober and have a sober lifestyle. But again, if you find yourself in a place where you're using, we do recommend that, in order for you to reduce overdosing, that you follow these steps. And again, I have to be repetitive when it comes to this because I'll get a lot of questions. But again, the county does not endorse individuals to use substances. But in the event that you are using, again, please do not use alone. Be careful about mixing drugs. Know your tolerance level. Be careful about the changes in quality or people that you're buying it from. And again, use fentanyl test strips. Okay. The county does provide fentanyl test strips as well. There's certain places, and we're going to talk about that in future slides, where you can test, if there's fentanyl in it. But again, the best thing to do is not even engage in these type of behaviors. And if you do need help, we obviously have the resources to help individuals in need. And any questions or any comments on what I just read? I know it's a lot of information in such a short amount of time. Do we have something in the chat, or?
Let's see.
I thought it jumped to 6, but I'm not sure if it.
Yeah, someone had a hand up, but I'm waiting for their question. So
Okay.
Yeah, I'll share it as a type.
Okay. All right, so I'll keep going, and then once you have it, you could ask me. That's fine.
All right.
All right, so another poll question. So people who have had at least one overdose are more likely to have another. And the answer is true, okay? So youths or adolescents who had an overdose with heroin are 471 times more likely to experience another overdose than the general population. Did we get a chance for that chat to?
Yeah. Well,
Okay.
one question.
Sure.
Would we get in trouble if we request test strips?
All right, so that's a very good question. You know, I would definitely check with, especially if you're getting it through school or a parent. You know, obviously to have that. For the county, you know, it's preventative, and it's making sure that you're safe. Just with naloxone, you know, you won't get in trouble for having it. But I would definitely, you know, check. Obviously, if you're underage, to check with an adult or a caretaker, and have that conversation with them. You know, this is one of the important things of why we're doing these workshops, to get not only the youth and adolescent, but the adults as well. I also do this for the adults and provide you know, answers to what ifs questions, and that's a great question. And for us, being that we're prevention, you know, we want to make sure that we prevent not only an overdose or a death, but you know, from any individual repeating certain behaviors. So you know, the answer for the county, it would be no. We actually have certain events where we do provide fentanyl strips and Narcan and naloxone. But again, if that question's diverted more to you know, a loved one, then I would check with that loved one. But we do provide, the county does provide that fentanyl strips and Narcan and naloxone. And again, we're going to talk about that here in future slides. But that's excellent question. Excellent question. Looks like we have another one.
Yeah. How long does it stay in your system? That's a question
Okay.
we had.
So naloxone stay in your system? Is that what the question was?
It didn't specify. I'm gonna guess that it was for fentanyl.
For fentanyl, okay.
Yeah,
So for
overdose.
fentanyl, again, depending on the potency, it can be from you know, a couple hours to several hours. And then again, it depends on the person's tolerance level as well. Because a lot of times the individual will need more than they did before, and not just to get high, just to feel normal. You know, a lot of times when they're having withdrawal symptoms, they don't even use it to get high anymore. They use it actually to normalize their pain, so they won't start, you know, the aches, the nausea, the constipation, you know, all of these symptoms that come with the withdrawal symptoms from fentanyl or any type of opiate for that matter. And some of the questions I'm going to go when it comes to naloxone, I'm going to hold off on them because it is coming up. But that's a great question. So what is naloxone and why does it work? Okay. So here we see another video, and again, these videos are going to be repetitive, so we actually understand what naloxone is and how to administer it, okay?
People are dying every day from opioid overdose. Parents and children, friends and neighbors. But naloxone can help. Naloxone is a safe and effective rescue medication that reverses the effects of opioids and saves lives. To understand how naloxone can stop and reverse the effects of an opioid overdose, it's helpful to see how opioids work in the body. Opioids are agonists. This means they bind to and activate specific receptors in the body, including the brain, brainstem, and spinal cord. When these receptors are activated, people experience the effects produced by opioids, such as pain relief, euphoria, calmness, relaxation, and slowed breathing. Taking too many opioids causes so many receptors to fill and activate that breathing may become dangerously slow and even stop. This is how an opioid overdose happens, and this is where naloxone can help. Naloxone has a strong affinity to opioid receptors, more so than most prescription opioids and heroin. But unlike opioids, naloxone is an antagonist. This means it attaches to opioid receptors without activating them. So when naloxone is administered during an overdose, it knocks the opioids responsible out of the way and allows breathing to normalize. Naloxone can be administered through an injection or a nasal spray. It usually starts working within a few minutes and lasts from 30 to 90 minutes. While one dose of naloxone can reverse an overdose, sometimes multiple doses are needed, especially in cases involving extremely potent opioids like fentanyl, or opioids that stay in the body longer than naloxone. Naloxone is very safe in single or multiple doses. It may produce withdrawal symptoms in people with opioid dependence, but it has no abuse potential and cannot cause an overdose. It's important to remember that naloxone is opioid-specific. It has no effect on an overdose caused solely by non-opioid substances like benzodiazepines or alcohol. At the same time, people shouldn't be afraid to use naloxone when the cause of an overdose is unknown. If opioids were not involved in an overdose, it won't cause any harm. If opioids were involved, naloxone can save a life.
All right, so from what we saw in the video here, obviously naloxone, what it does, it kicks out the opioid receptors from binding to those receptors, the opiate dopamine rather, from binding to those receptors. And like the video said, it kicks them out. Now, what they were talking about withdrawal symptoms. So for example, let's say you come into an individual who has a history of opiate use. You go ahead and administer naloxone. What happens is there's a window between 30 to 90 minutes where naloxone is gonna work. It's gonna kick the dopamine out from those receptors, and it's gonna take its place. Now, the problem is if this individual has used opiates or heroin or fentanyl or whatever the case is, any type of opiate, they may have withdrawal symptoms. So, they're going to start feeling nauseous, constipated, their bones may be aching. They're going to feel sick, not because of the Narcan, but because now you displaced the drug. You took away the drug from the receptors, and now the Narcan is there in place. So that's what happens sometimes. Now, one thing that the video also mentioned is you cannot overdose on Narcan or naloxone, but it only works on opiates. So let's say if somebody's drunk, it's not going to work. So somebody may ask, well, what if you give it to them? Well, unless the drink is spiked with opiates, it's not going to do anything. So the best thing is, if you don't know what they took, and you want to administer naloxone, you can. It's not going to do anything. The only thing it does, it kicks out basically those from the drug from being in those receptors, and it stays in that place. So they don't get the high, they don't get the effects of the drug, so to speak. So that's what naloxone does. Any questions on that, or any comments or anything? Not sure if there's something in the chat, but
Yeah, Luis, we had a question.
sure.
Can people take naloxone before they take drugs to prevent an overdose?
They can. The only thing is, because again, like it depends on the time. So for example, if they take, let's say naloxone, and then right after that they take whatever type of opiate, there's going to be a duration from 30 to 90 minutes. So what's going to happen is that individual is not going to have any effect from the drug because they have the Narcan or naloxone in them. So it's if they take it beforehand, I mean, that's great. I would recommend that they get help instead of taking that. And a lot of individuals, I've worked with the community, and a lot of times I do get this question with individuals that are using to kind of prepare themselves. But the reality is, there's two Narcan in each box. So again, depending on the potency. So let's say you took way too much from what you were supposed to take. you know, and you take it alone, obviously one is not going to do the trick and you may need another. Who's going to be there to help you out if that does happen? So it's not always guaranteed. Sometimes you do need 2 naloxones or even 3, as you saw in the video. It just depends on the amount of opiates and fentanyl or whatever type of opiate that the individual took. And sometimes it could be too late. You know, sometimes you run into an individual, but they're too far gone because they've been in that state for several hours that it's, you know, it's not going to do anything. But again, it's best to do it as soon as you notice an overdose, and it does last anywhere from 30 to 90 minutes. So hopefully that answers the question to the person that did you know, have that question. All right, any other questions or any other comments?
Not at this time. Thank you.
Okay. All right, so again, we kind of see just repetitive, you know, naloxone kicks out the opiates from the brain receptors and blocks the receptors for 30 to 90 minutes. A person cannot overdose on naloxone. That's important to understand. You know, I did have parents at one school that did tell me, you know, I don't want my kid going from one drug to another. And we did assure them that, you know, this is not a drug, this is an antidote. And all it does is blocks the opioid receptors. That's all it does. And again, naloxone is not effective for alcohol or benzodiazepines, but as we know, sometimes, a lot of times they do mix it with other things, and it's good to administer it just to make sure. Looks like we have something in another person in the chat. It looks like
They were just saying that answered their question regarding the overdose. Thank you.
All right, perfect. All right, so another thing that comes up sometimes is, you know, if I help, I'm going to get in trouble or I'm going to get sued. It's best not to help out, especially if I'm out and about in the community. You know, I don't want the law coming after me. So the good thing about this is we do have something called the Good Samaritan Law, which, you know, this law encourages bystanders and volunteers to act according to an emergency. So if you act in good faith, you know, obviously nothing will happen, provided that you know, call first responders and you make the appropriate decisions. You know, obviously, if again, depending on the situation, you want to make sure that you're safe as well. For instance, if you're in an alley and you see somebody that's passed out and they're surrounded by a bunch of people that, you know, you don't know if they're going to be a benefit or a negative. If you do encounter that situation, the best thing to do is just call first responders and kind of let them handle the situation. But if you come across an individual that is, you know, within the means of being helped, you know, by all means help them. And again, the Good Samaritan Law protects you from doing so. Any questions on the Good Samaritan Law? All right, perfect. All right, so we're going to go to the next slide here. So where can I get naloxone? Okay, we're going to talk about those places here. Now, there are a few places where a teenager and adolescent can get those, and we're going to go over those here in a bit. What happens if a police officer finds naloxone on me? Okay, so it is legal to carry naloxone. You will not get in trouble or arrested for carrying naloxone. Okay. Number 3, what if my parents or guardian find out I have naloxone? You know, again, in terms of the county, you know, we would not know what your parents or your caretakers would do. I would hopefully that they would, you know, have a conversation with you and you could explain to them like, look, this is a big thing in my school. I carry it just in case some of my, you know, peers may fall victim to an overdose. Or if it is that, you know, you yourself need help, you can explain that to your loved one. And again, we're going to talk about where to turn to if you need help. There's no wrong way to receive help, and we're going to talk about that here in a second. Okay, so how to respond to an overdose with naloxone. We're going to go over the steps here, and then I'll provide those resources for you all here in a second. So number 1, what's going to happen is we're going to call 911 immediately. If there's a second person, have them call the dispatchers or 911 while you stay with the person until they arrive. When you call for help, you know, let them know that the individual is unresponsive and obviously listen to what they're telling you. If you have evidence of an overdose, please convey that to to the first responders. And then again, stay with the person if possible. If there's another person, have somebody stay there with them. Second step is obviously give naloxone. And you want to make sure that you do tell first responders that you have naloxone, and based on the responses that they give you, go ahead and administer it. And here you go, we see it again. Naloxone is a safe antidote to opioid overdose that has no risk for abuse or dependency. So that's important to understand. And again, there's 2 per bag. Sometimes there's 2 per box. It just depends how they package it. Usually it comes in a little box. The county provides green bags. I don't know if they still do. Certain events they still do, but normally it's in a little box, and there's 2 in a box. And again, you may need more than 1 dose of naloxone depending on the individual. And then lastly, you want to make sure that you place the, if you have to leave for any reason, you replace the individual in the recovery position. So the recommended position, it says here on the left side, but in actuality, it really doesn't matter if it's the right or the left. At one point, there was debate whether, left or right. It doesn't matter. It doesn't matter, to be honest, if it's the left or the right, as long as you see that they end up in the position of number 4. So for example, number 4, they're on the right side. So that means their left arm is under their chin and their left leg is elevated in the L shape. So obviously, if they're laying down on the opposite way, it would be the opposite in terms of the recovery position. And again, sometimes, with naloxone, it depends on the individual. You want to make sure that you explain to the individual if they do come to, like, you got to imagine if you're passed out and you wake up and you have X amount of people around you, you're going to get scared. You're not going to know what's happening. You want to make sure that you relay that information to the person. Like, look, you just overdosed, you passed out. We gave you naloxone. We're waiting for first responders to come and help you. Everything's okay. Don't worry. Again, don't try to grab the individual. Do not try to press them, pull them down or hold them down because you don't know if they have prior injuries. So all you got to do is just discourage them from leaving without getting physical, and just let first responders, do their thing. You don't want to chase them, obviously, if they fall and hit their head on somewhere or something like that. You administer it, you gave them the recommendation. It's up to them whether they take it or not. 9 times out of 10, they'll sit there and wait for first responders to arrive, but that's not always the case. But it may happen. It's just a disclaimer. Now, I'm not going to go too much into this. For those of you who are certified and want to administer rescue breathing, obviously you feel free. You make sure that their airway is open, and you administer chest compressions. And again, I'm not going to go into this because you do have to be certified in order to provide breathing, rescue breathing. So I'm not going to spend too much time on it. But if you're certified, go ahead and listen to first responders and see what they recommend as well. All right. So again, naloxone instructions. What you do is when you do have it out of the box or out of the kit or whatever style it comes into, you peel it, you place it under their nose, make sure that the bottom of your fingers hit the top of their nostrils, and you just press. So it's basically just like, any other, nasal spray, basically. But it just so happens to be naloxone, and it's it's important that you administer it in that sense. So peel, place, and press. Okay, those are the steps to taking it out. And we're gonna have another short video, and then we're gonna go into the resources here in a second.
If you suspect someone has overdosed, try to get their attention by firmly rubbing your knuckles up and down the center of their chest. Next, call 911 with your location and the person's symptoms. Now it's time to administer naloxone. Peel back the package to remove the device. Place the nozzle tip in their nostril until your fingers touch the bottom of the nose. Press the plunger firmly to release the dose. Place the person on their back and tilt up the chin to clear the airway and support breathing. Give a second dose if the first one does not work within 1 to 3 minutes. Care for the person by rolling them on their side. Stay until medical help arrives.
All right, excellent. So again, we're just going to go out, some stuff that's repetitive after providing naloxone. Call 911 if nobody has done so. You may need to give a second dose. Remember, they still need medical attention after waking up. Consequences of not getting medical help, obviously, they can go into overdose and pass away. Discourage them from taking more drugs. Again, this doesn't happen all the time, but there may be cases in which, you do administer the naloxone and the substances is out of their body for the moment. And they do want to go get high again if the symptoms return. But again, that's it doesn't happen too often. I've yet to meet somebody who's done that. Does it happen? Yes. But it's very, very, very rare that it may happen. Usually when you administer naloxone, a lot of times there's confusion. What happened? It's okay, you overdosed. 911's on their way, calm down, everything's okay. And that's basically it. A lot of times they're grateful that you saved their lives. But again, we got to put out there for those unique cases that sometimes, they don't know what's going on. They may have mental health issues, and they may think that you're doing more harm than good. So you want to be aware of that and make sure you're safe as well. After providing naloxone, again, repetitive stuff, make sure that you explain to them what happened. They may go through withdrawal symptoms depending on if, it starts wearing off. Again, if they have withdrawal symptoms, they're gonna, again, they may possibly seek the drug, or they may just stay there confused, waiting for first responders, which majority of the time that's what happens. The next thing we're going to talk about is storage and disposal. Make sure when you do storage, it's at room temperature. Please keep it in a safe place. Now, when I say keep it in a safe place away from children and pets, usually people say, it is dangerous. That's why they say keep it away. Well, the reason too is you don't want to destroy the naloxone or make it go to waste. That's the reason why we put that out there. That in the event that you do need it, it doesn't go to waste by being destroyed or something like this. Do we have a Q&A? Looks like a question or no?
Yeah, one question.
Okay.
For the previous slide, is it just in one nostril or both?
No, it's one nostril. Yeah.
One nostril.
Yeah. And you got to remember the nasal cavity is connected, so it's going to go straight to the brain.
Ah.
Yeah.
Okay.
Yeah. So it doesn't matter if it's one or the other. The nasal cavity is connected to the brain, so it's not. As long as you do it in one nostril, it's fine. All right. Great question. All right. So expiration date. Okay. So the shelf life is about 2 to 3 years. Now, somebody asked me, what if it's expired and I'm walking down the street and somebody overdoses? Can I use it? For me, I would use it. The only thing is that the potency is not going to be as strong as it was before. As some of you may know, when it comes to medicine, it loses its potency. So it's either going to do something or it's not going to do anything at all. But again, make sure, and then I'm talking about if it's like a couple months or weeks. If it's like several years, like 10 years or whatever, you might want to get rid of it. Because that's a long time. But if it's a couple months or even a year, I would use it if that's the only thing that you have. It's better than not having anything at all. And again, you can go to your local pharmacy and dispose it, whether it's CVS, Walgreens, and anywhere they have a pharmacy, they can go ahead and get rid of it. All right. So the question is, should you leave the person alone, put them in a bath, induce vomiting, give them a drink, or pound on their chest to wake them up? Okay, so no, we do not do any of the above. Okay, there was a misconception back then that you put the person in a cold bath. Obviously you don't want to do that. The body can go into shock, or the person can drown. I mean, it's just as simple as that. And if you're not strong enough to lift up the individual, they can have water go into their airway and into their lungs. Again, you don't want to induce vomiting. Again, it blocks the airway. That's not a good thing to do. Do not give them anything to drink. I know in the past individuals would say, "Oh, give them coffee, give them milk." You don't want to do any of that. Again, it's going to block the airway, and you don't want that to happen, especially if somebody's overdosed. Again, don't pound on their chest. You know, if you want them to listen to stimuli, or if they're awake, you know, you can kind of shake them, but not to the point of punching or pounding. You know, you might cause them more harm than good. So to the audience, have you heard of any other myths that people would use to have individuals come out of a overdose? You know, we talked about putting them in a bath, inducing vomiting, giving them stuff to drink. To the audience, any other you know, other myths or things that you've heard of? And it can be anybody, it doesn't matter.
I heard like splashing water on their
Okay.
faces.
Right. So again, you know, we don't want to splash water on their faces. We want to just make sure that, you know, they're taken care of, and we do things the right way. But yeah, great questions. You know, great questions.
Oh, yeah. Somebody mentioned milk again, but yeah.
Yeah. Yeah, absolutely. And there's a reason too. Like if you notice, when somebody overdoses, you know, in the hospital, they don't induce vomiting. You know, they either pump your stomach, or they either at times, I think at one point they used to give charcoal so they could absorb, you know, all that stuff. They don't induce vomiting. You know, even when you, let's say for example, a product that you're not supposed to ingest, like a cleaning product, it even says in the back, do not induce vomiting. And there's a reason for that. You may cause more harm than anything. So you want to make sure not to induce vomiting, because it may, you know, make the individual worse than what they are. All right, so again, we're just going to talk about the 3 steps. Call 911, emergency services, first responders, provide naloxone, and place them in a recovery position. And here you have bonus points. If possible, stay with the person until help arrives, and encourage them to seek medical help when they wake up. Again, not touching them, not grabbing them, not holding them down, because they might, you know, fall or slip or trip or whatever the case is. Do we have somebody else in the chat? It looks like it went to 11.
Somebody was recommending asking about orange juice, but you said no drinks.
Yeah, right. Again, we don't want to block the airway with any type of substance at all. You know, so yeah, we want to make sure we keep the Pulp Fiction myths away from you know, somebody saving their lives. But yeah, so again, you know, be prepared. Don't use alone. If you are using, again, Los Angeles County does not advocate for somebody using, but if you do, please do not use alone. Tell a friend or family or loved one, or someone what and how much you're using, and have naloxone around in case, you know, something happens. You know, because at times we do recommend, especially clients when they're in recovery, and the recovery is not going so well. You know, we also recommend, you know, at least take naloxone in case you never know. But again, we don't encourage it. We encourage sobriety, a healthy lifestyle, and there's always help. So where can you go to get naloxone? Okay, great question. So you can either go to your doctor, local pharmacy, some, you know, insurances or Medi-Cal will cover it. Here you see California Department of Public Health exchange programs. Here we have another syringe exchange programs, you know, different places. And here we have a continuation, you know, Asian American Drug Abuse Program, and then we have several other clinics, Tarzana, LA Community. The county also has sometimes, you know, health fairs where they do give out naloxone and fentanyl strips. So it just depends on where and how. Now, we do have this youth-friendly resource if anybody wants to check it out, lacelethal.com. So, you know, any questions about fentanyl, naloxone, resources, frequently asked questions, you know, feel free to copy this down, and I can provide that to you as well, if need be. So, you know, any questions or anything that's related to substance use or any type of resource, you know, you can go ahead and have this information for you. And again, we have other resources for youth. like Youth Suicide Prevention Project, Crisis Text Line. These are all great resources to have. And again, I can provide all those to you as well, either via email or perhaps after the presentation, we can talk about how to provide these resources. And then we have eligibility and access. Individuals that have private insurance, Medi-Cal, My Health LA, or any other type of county-funded program. We have different types of treatment options, outpatient, inpatient, and again, so a lot of resources. And again, here we see no wrong door pathway to access drug and alcohol treatment. So if it's either for yourself or a loved one, feel free. I'm going to keep this here in case you want to copy it as well. But any information that was in the presentation today, obviously feel free to take it with you. If you have any questions, feel free to ask those questions. Looks like we have some more questions in the chat.
Yeah, one question. What if the person is in another state? I think they're asking, can you send Nox like in the mail, or do they have resources in different states as well as?
Yeah,
LA
so
County?
this is a national crisis, especially fentanyl and overdose. So I would check with the local county authorities and find out, what resources they do have available, because they have them. I mean, you name the state, they have the resources. But yeah, that's a great question. Great question. I would check with those resources first. That way you don't have to waste, mailing or doing all these other things, and you can have those resources ready for that individual. But that's a great question. Awesome question. Any other questions or comments or? And again, I'm gonna leave the SASH hotline there, the core centers, which is what we do, SENS department and the substance use providers. So these are all pathways to, for somebody that needs help, they can contact these agencies. Here at the core center, that's what we do, prevention, but we also refer and screen individuals to get the resources that they need.
And these core centers are located throughout LA County?
Correct. So we have several spots throughout Los Angeles County. Specifically here, I'm in South Los Angeles, Martin Luther King outpatient. So it just depends on which area. But yeah, we have them all over Los Angeles County. And again, any information, Stephen, that you would like or like to share, I'd be more than willing to share that with you. And then we could go ahead and forward that to anybody that is joining us today or would like to join us in the future.
All right, thank you. Yeah,
Sure.
after this program, we'll definitely be sending out the information to the folks that participated in our session. And thanks to everyone who joined us for this hour, and especially Louise, thank you so much. I learned a lot, and this is such an important and life-saving, topic. So thank you for the work that you do and that your colleagues do for LA County.
Yeah, well, thank you for allowing me, having the platform to show these resources and information. Thank you for that.
And for audience members, we'll be posting a recording of this video up on the LA County YouTube channel in the next week. So if you want to review it or share it with your friends and loved ones, that will be available to you soon. And again, we'll be sending that information out in an email. And again, one more question coming in. How much does it cost for the Nox?
So I would recommend receiving it at one of our resource centers. Even here at the core center, if you'd like to pick one up, they're always free, but it would depend on where you get it. Generic would probably like maybe $35, $40, all the way up to $100. But I would definitely utilize the resources that we have through LA County. That way, you don't have to pay out of pocket, and it'd be best that way. Yeah, definitely the core centers.
Do you know if this is covered by medical insurance? That was a question that we had.
Yeah, so there is, if you have private insurance, again, depending on the stipulations of your insurance, Medi-Cal, My Health LA, so yeah. And again, you can always, ask your doctor or your insurance to make sure, yeah.
Great. Any more questions from the audience for Luis while he's here? Waiting. If not, again, thank you so much, Luis. And
Sure,
just
absolutely.
as an announcement, our next virtual program for Life Skills for Emerging Adults will be on March 16th, 2023, on the topic of mental health. And we'll have speakers from the Los Angeles Department of Mental Health. And this month and next, we'll also be hosting in-person programs on additional topics at LA County Library branches in Lancaster, San Fernando, Compton, South Whittier, and East LA. You can register and find more information on our website at visit.lacountylibrary.org. Once again, I'd like to thank you all for joining us today, and thank you so much, Luis. And
Thank you.
have a good night, everyone.
I think good night, everybody. Be safe.
Bye.